Welcome, everyone. I'm Dr. Deidre. Today, I am conversing with therapist Abby of Abby's Telehealth Social Services, where she specializes in a host of social services and treatment approaches for children up through the elderly. Research shows that telehealth sessions can reduce hospital readmissions up to 25%. That's according to the American Journal of Managed Care. Welcome, Abby.
Hi, how are you doing today?
I am well, and I'm so glad to have you here. I know you're going to answer a lot of questions that might be out there within the community dealing with telehealth services. So let's jump right in.
Yes, ma'am.
All right, what inspired you to become a social worker and what drew you to specialize in telehealth services?
Well, what inspired me to get into social work? I once was a single mom and I had to depend on services from the Health and Human Services. And I never forget the feeling I had when I had to receive those services from the state. Funding was there. The problem was how I was treated. I felt like I was a number. I was ashamed to get the help. I didn't want to go to the interviews because I just felt like I was being judged. They did offer me food stamps at the time, Medicaid, and they also had child care assistance where I can apply for. But it was like if I had the opportunity to be in their shoes as the caseworkers, I would want to give empathy and sympathy to my clients because they're already vulnerable. I would let them know this is not your situation. This is just something that's going on temporary. This will not define you who you are. But at the time, I didn't know what the name of the career was. I didn't know it was social work. I just thought it was case management. So I just said, I really want to help people. I really want to make a difference within my community. And I just kept replaying in my head how it felt to talk to those people. It was like they was angry, they was burnt out, and here I'm coming vulnerable trying to seek services and felt like I was a burden or just made me feel like I was afraid to keep asking for the assistance when assistance was needed. Another thing that made me want to become a social worker, my mom used to work for a company called Healthy Families. And it was a company to help parents and keep their children in the home. They would court orders to make sure they are monitored and make progression. So I don't know if you remember back in the day, they used to have when you go to work with your parent day,
Yes.
and
Yes.
I was able to go to work with her. And when I went to work with her and I seen that she was helping her clients, get the services they need, she was able to take assessments. At that time, I didn't know it was assessment. I just thought she was taking notes. Seeing how she was able to make a change within her community. And when I was at work with her that day, I just felt a sense of sensation. It was from my head to my toe. It was like I was a Cinderella that finally found my glass slipper. It fit. But at that time, I still didn't know it was called social work. So pushing forward a little bit, I did go to college. I did talk to my academic advisor who was going over degree plans, and she pulled up social work. And I felt that same feeling again that I was telling you about, Cinderella putting her glass foot in her slipper and it fit. And I told her, this is what I want to go to school for. And so that would inspire me to become a social worker. And I did fulfill my dream. Now, going back to your question, how did I go to telehealth? I just feel like it's beneficial to me and it's beneficial to the clients that I serve. Everybody want to feel comfortable of being in a place to where it fits them. So starting my business, it was always a telehealth social services business because you just never know what it takes to get to an appointment. You have your working class, they have to use their PTO, they might have to use their sick time just to attend to their mental health. Who want to use that? I want to be just like every other business that's able to use technology. So I'm right at the hands of their phone. You just click the button, make your appointment, and we able to have our session. So that way it's benefit not just only to me, it's always benefit to the client. And then you have your children, they engage in extracurricular activities, or they may be tired from going to school all day. Why not be able to make that appointment at the convenience where they're comfortable at? So that's how it was started.
Most definitely. What a phenomenal story. Just generations of social work that started with your mom. And I'm sure we could go on and on about the women who step up and help before they called it social services, they just stepped up and helped other people in their community. Outstanding. Okay, can you share the story behind the creation of Abby's telehealth social services?
Yes, my creation, Abby's Telehealth Social Services, it came from a vision I had to provide social work to clients who want to be serviced from where they are. I want to provide service for my clients at their time without clients have to travel. Clients can focus on a better pathway to success. Imagine, just like I told you earlier, just imagine trying to just get that appointment in. You have traffic time. Not everybody might have transportation to get to the appointment. You never know. I also, Abby Telehealth Social Services, we specialize outside the hours of 8 to 5 because anything can happen. And I always tell my clients, if you need to get to me, I'm just a phone call away because we cannot control when life happens to us. And so I want to make sure that I'm there for my clients, not just on a personal, professional level, if they need me beyond that, because a lot of people, they just don't have anybody.
Yes.
They don't. So if I'm that person that can help you, then let's schedule a session. Even if we can't do a telehealth at that time, if it can be just a phone conversation at that time so we can get to telehealth, why not reach out? Because I make that dedication to my clients to do that. So I did collaborate with Simple Practice, who envisioned my vision I had for my practice, and they was able to give me the platform that I needed to start my services. And it's just pretty much my vision since I came out of college. I just want to be a social worker that can help you and make success with you, and you don't have to deal with it alone. You're gonna always have somebody when you contact Abby Telehealth Social Services.
All right. All right. Now, how has your experience in anger management and family conflict shaped your approach to therapy?
Actually, before I started my practice, I was a youth and family support specialist. I worked with foster youth who's in CPS custody, and they was in a residential living facility. And of course, it was broken bridges between their family and the youth. So I stepped in and I was that bridge to assist them to make reconnections. So during my experience and my work background, I learned that dialectic behavior therapy is a form to where you can help individuals with intense and frequent anger to help clients regain emotional control, because sometimes it's just out of our control. Yeah. And you may need that extra help so where you can get that control. So, and I also noticed when I was working with the foster care youth that anger is a universal emotion.
Yes.
It can arise in response of a threat, loss of power, or if somebody's feeling like they don't have injustice. So cognitive behavior therapy, it helps my clients, they understand their triggers, and we can develop and come up with different coping skills so that they may be behave differently and think differently and also respond differently. So my clients could be more calmer and be in more control. And it's the same thing in family conflict. We just want to make sure that we are listening to everybody and we're resolving the issues, and we are resolving issues that can be maintained within a family conflict.
Abby, it's some amazing work that you're doing. So what are some unique challenges you face when working with blended families?
Blended families, you got to understand that you're dealing with different type of mindsets. You got, say for instance, we have a family of 4. You got different type of mindset. Mindset 1, mindset 2, mindset 3, mindset 4. So I always try to not only focus on what the client is coming to me as a need, I try to focus on their strengths. You got to empower their strength with your clients. You got to make sure that they know that they're being praised. Who don't want a pat on the back? So some of the conflict that I do experience, I will let you know, is communication. Sometimes it can be challenging to maintain open and clear communication, which is important for making decision making and to address conflict. Another thing that I do come across is when they come with children, they may be used to different parenting skills and routines, which can also cause conflict with the step parent or the parent that's not in a new family. I also have came across cultural differences. You got to understand when it comes to cultural differences, couples might need to learn about the different traditions, lifestyle and purposes of that new culture that's coming in.
Most definitely. So, how do you tailor your techniques? I heard you mention children. How do you tailor your techniques for different age groups, such as children, adolescents, and even college students?
But like I said, I always focus on the needs and the strength of each client. That plays a big factor when you do come up with those different coping techniques with those different age groups. I also refer to the 5 main types of coping skills, which
Okay.
is the problem focused strategy, the emotional focused strategy, the mean making, social support, and religious coping. And for each age group, I just focus on the client's need. I refer to the type of skill that is needed because they may not need, if they come to me about a problems focused coping skill that need to be addressed, I don't need to cross intersect of social support. We want
Right.
to stick to that main focus strategy for their coping skill and just interact with the client to where they at. I'm not going to treat a toddler the same way, the approach the same way as a college student. You have to find that approach method to where you can gain that client's, trust and make sure that they're comfortable of where you're coming from.
Outstanding. Yes. No one wants a cookie cutter approach when it comes to therapy, right?
No.
So, what do you find most rewarding about working with children and adolescents in your telehealth business?
Well, I do know for the parents, it does reduce time and travel costs for them.
Yes.
It also improves the access and availability for the appointment. And it can also make the child just feel important as an adult. They always see mom, dad, or probably brother and sister on the computer taking care of business. So when it's their turn to get on the computer and they having their session, it makes them really feel important, like they're the boss at that moment. So it just brings joy to me when I'm able to see them, how they can get on the computer, they can navigate, they can open their own appointments up, and some of them know how to schedule their own appointments. So it just
Wow.
amazes me. And also one of the things that's very unique about this, I always ask the child their input. How do you want your sessions to go?
Mm.
It's always very important for my clients to know I'm not here to make the decision for you. This is your life.
Right.
I'm just here to assist and guide you. I never want to make a decision for my clients. So I want to always get their input on how they want sessions to go, and then I incorporate it into the visit.
All right. So, how has the transition to telehealth impacted your practice, especially in terms of client engagement and outcomes?
Well, my practice has always been in telehealth for my clients from the
Mm.
beginning.
Okay.
When I had my first client engagement, it has been successful only because I work with clients who want the help.
Mm.
You have some businesses, they have to be referred to or it's mandated that they take the services. Instead, I want to work with people. I do work with people who sign up personally and say, this is what I want, because it makes the relationship so much more smoother when you want something.
Yes. Okay. Now, can you discuss a particularly memorable or impactful case that has influenced your professional journey?
Yeah, so I actually had a client. She was staying with her family.
Mm.
She had just lost her job. She was experiencing hopelessness. She just didn't want to get out of bed anymore. She just thought that everything was just coming to an end. So I actually met this client. I knew her personally through church. We went to church together, and we actually had an event. And so I had let my church know that I had just opened up this business. If anybody need free consultation, to reach out to me, and we can go from there. And so she had immediately reached out to me. She said, Miss Abby, I really need to talk to you about some things. We did go through the steps. We did the relationship building. We did the problem assessment, goal settings, the intervention and evaluation determination. If I need to do refer, I was going to refer her out. So she, at the end of all the hard work that we went through, she had a success story. She got a job. She went back to college. She moved out her family's home. She was able to get her keys to her first apartment. She was like, Miss Abby, I plan on getting that house, even had to start from a rent house, but I at least have my own keys. And she said, I appreciate you so much. I was at the bottom to where I just thought this was going to be my ending point, just staying with my family and just keep experiencing these feelings over and over again. She said, you know, once you worked me, you were so patient with me. And she said, I really appreciate you. So I was so ecstatic about this success story, and it really impacted my journey with my other clients to let them know it is a success story behind everything that we go through.
Oh, most definitely. What a testimony. So
Yeah.
let me ask you, how do you stay updated with the latest developments in telehealth and social services?
Working with other social workers, engaged in continued education courses and trainings. You know, it's not only so important to obtain the knowledge, but to make sure I'm refreshed and networking with other professionals.
All right.
Yes,
Now, what
ma'am.
strategies do you use to maintain a healthy work-life balance while running your own business?
Self-care. You know, I always encourage my clients to practice self-care all of the time. So, you know, I take my own advice. I make time for my family and my friends, celebrate my accomplishments. A lot of times we don't celebrate our accomplishments. We just feel like we just got to keep going, keep going. I got to do this. I got to do this for my next step, and take time just to celebrate yourself. And I like to
Amen.
embrace my hobbies, and I have to learn there's a line between work and personal time.
Yes, most definitely. So,
Yes,
how do you
ma'am.
address the stigma associated with seeking mental health support, particularly in younger populations?
Well, I just make sure my client understand it's okay to seek help.
Okay.
A lot of times people don't want to let normalize it's okay to seek help, to be a healthier them. I empower my clients and encourage them that you're one step closer to achieving their goals. While achieving their goals, you don't have to be alone. I'm here every step of the way. Even at the termination of service, I continue to check on my clients at least once a month, up to 6 months. Now, if they need additional check, we can rearrange to see what can work for them to continue with the services, and just let them know life can happen to anyone anytime. You
Mhm.
know, we can't control life, and we have to also know it's always going to be a social need in every ages of life, from children, adolescents, young adult, um, elderly. It's
Yeah.
always going to be a need for social work. So don't be afraid to enrich your mental health to be a better version of you.
All right. You heard it from
Mm.
the expert. Now, what advice would you give to an aspiring social worker who wanted to start their own practice?
Follow your dreams. When you think the sky's the limit, go beyond that. It can be done with hard work and determination. After you complete college, take your status down, get licensed, apply for your NPI number, open up the business, and don't stop. You know,
Yeah.
keep pushing. If your heart and desires to be a PhD, go for that. Because social work is everywhere. Like I said, it's in our churches, it's in our jobs, it's in our community, it's in every age group of life. And it will always be a need for a social worker.
Most definitely. All right. Now, how do you incorporate cultural sensitivity into your practice, especially when dealing with diverse family structures?
Making sure that I'm aware of the culture competency. Make sure that there is effective communication in intellectual situation. Treating everyone with the utmost respect, regardless of their race, culture, and religious views. You know, getting to know my client before the session allows me to gather information that may cause culture sensitivity, so everyone is respected and is also valued.
All right. All right. Let's inject a little humor into this interview. I have a question I'm going to ask you now. So they say telehealth is great because you can wear pajama bottoms and nobody knows. Do you have
Yes.
a funny telehealth wardrobe malfunction story that you can share with us?
Of course. I'm not gonna lie to you. One day I had totally forgot about an appointment. And so some says you need to be doing something. It's something that you need to be doing. So I was able to go to my home office, and I seen that I had an appointment literally like 5 minutes from the time that we was at in current time. So I said, "Oh my goodness!" I hurry up and I ran. I had got a blazer, put my shirt on, and I kept my pajama pants on. And I just completed my session like I was fully dressed, and the whole time I was not. So that is a true statement.
Well, I can tell you I have a few of those too, but we won't get into that. It is not about me today. So let me ask you now. This is a kind of weird question, but do you ever get tempted to diagnose your pets if you have any or your plants? Because I have plenty of those because you're at home.
To be honest with you, the plants are good, but I do have a Chihuahua. She's actually an elderly dog. When I got her, she was 14 years, so I can only imagine how old that is in dog years.
Right?
And she thinks she is the queen of this house. She will bark at you, and when you have food, she's your best friend. And the moment you don't have food, she won't look at you or nothing. So I said, you know what? If you was human, I would diagnose you as bipolar. One minute you my friend, the next minute you don't want me looking at you.
Wow. Well, let me tell you, I'm not a professional therapist, but I definitely give therapy to my plants. I talk to them and I let them know that they are doing very well. And so I encourage them and everything. So, all right.
Yeah.
So let me ask you, Abby, what future goals or plans do you have for Abby's telehealth social services? And how do you envision the evolution of your practice?
Well, my future goal is to have a franchise of Abby Telehealth Social Services where social workers will come in and we can practice together on helping others along their pathway to success. I want I want the world to know that receiving help in social services does not mean that you need to be afraid to receive
Mm,
services. Because, like I told you earlier in my story, I was ashamed to ask for help.
mm.
And it was based on how I was treated. So I want to make sure that my franchise, when that happens, no one's afraid to ask for their help because they're going to be treated from the moment they come in the door with respect, dignity, with empathy and sympathy. I want to embrace knowing my clients to embrace it, to know that they have someone by their side, and I don't want to just do it by myself. It's so many social workers when they come out of school, they accept low pay just to get a job. They're trying to obtain the knowledge, and I want them also to have a place where they know they have a safe place to come work at. I envision the evolution of my practice by continuing to getting the word out, allow time to take its course, and know it will happen.
All right. Amazing. Where can we follow you at, Abby, or contact you about more about your social services and your treatment approaches?
I am on Facebook. You can just
Okay.
type in Abby's Telehealth Social Services. I'm also on TikTok. You can type in Abby's Telehealth Social Services. You can also go to Google and type in Abby's Telehealth Social Services. And I do have an email address, which is family social worker, the number 4 at gmail.com. And just send me an email and we can take it from there.
Outstanding. I am so glad that you were able to find the time to come and sit with me and just talk to the community about the wonderful things that you're doing with Abby's telehealth social services. So, hopefully you'll come back because we need to know this information and you have dropped a wealth of knowledge for us to just kind of decide where we are in our lives and what services we may need. So, thank you.
Thank you so much. I really enjoyed coming on the show.
All right. Remember, self love is sexy. Be selfish in your love for self and selfless in your love for others. If you enjoyed this video, like it. If you found it useful and want to see more, subscribe. If it pertains to someone you know, share it. And if you have an opinion, leave a comment. A conscious heart will do all four. Thank you.